Stephen. I'm having a hip surgery in a couple of hours. I wanted to take a minute to talk about some of the symptoms I've been having, as well as show some of the movements that really have been giving me issues, and I'll do a little before and after comparison, and also capture some of the recovery along the way. So hopefully this will give someone else in my situation a better idea of what to expect with the surgery. So a little bit of background, I've been dealing with the issue for years now, and I finally got an MRI arthrogram a couple of months ago, and I'll read the results of that report. And I am not a medical professional, I'm an engineer, so I will try to explain some of the terms as I understand them, but forgive me if I don't get them exactly right. The results of the MRI were anterolateral, which means front, and outside labral tear, grade 2 to grade 3 chondromalacia to the acetabulum. The acetabulum is the socket side of the hip. And chondromalacia, as far as I understand, means softening of the cartilage, where grade 1 is normal and grade 4 is bone on bone. So I'm somewhere in the middle there. It said no full thickness cartilage defects. And then it found femoral head / neck cam deformity, which means the ball side of my ball and socket joint isn't perfectly round. And then finally it said degenerative cystic changes in the femoral neck. So my surgery today is going to fix the torn labrum and shave down that cam deformity, which was causing the impingement, which probably caused the tear in the first place. I cannot pinpoint any moment in time where I may have actually torn the labrum. I don't remember any significant trauma or any acute injuries. And I do have days where it's barely painful at all, and I have other days where I can't even sleep because of the pain. I've had the issue for about as long as I can remember. My first memory of it was being asked to sit on the floor cross-legged. I think it was in kindergarten, sometime early elementary school. And I sat in a cannonball position because that was more comfortable, and I remember getting scolded by the teacher for not following directions. And that still pisses me off to this day, but that's not really important here. And then in the weight room in high school and junior high sports, when I first learned to squat with a barbell, it just never felt right. And I felt like I was always fighting to keep from falling over backwards. And I thought I was just really weak compared to my peers. Hopefully that's not actually the case. I think I've realized since then that I was actually putting my body in a really disadvantaged position from a mechanical perspective due to the geometry of my body. I was a distance runner in high school too, and had lots of issues with my IT bands, which is not nearly as bothersome to me now since I only run a couple of times a week. But I'm curious to see if I get any relief from the tightness in the sides of my hips. I've also noticed that I seem to have some excessive anterior pelvic tilt, or Donald Duck butt. So it'll be interesting to see if that resolves a little bit too, especially if I end up getting the other hip done, which also has the impingement issue and a smaller tear. And while I'm talking about other random issues, I've been struggling with quadriceps tendonitis on my right knee, so just above my kneecap. And I'm really curious to see if there is some kind of compensation factor that was aggravating that, since that's the opposite of the hip that's really bothering me. But of course it'll be kind of hard to attribute any improvement to the hip surgery versus just being forced to take a few weeks off, having very limited activity during my recovery. To this day, I still have a really hard time sitting on the floor. Cross-legged hurts really badly now, especially with the torn labrum, but even before that, I've noticed I feel like I'm fighting to keep from falling over backwards when I sit on the floor. And this is most apparent when I've gone to yoga classes at the beginning or end where they have everyone just sit comfortably. I've never been able to find a comfortable position. I feel like I'm either straining to sit up straight, or I just have to pile a bunch of blocks under my butt. I really enjoy CrossFit, but I've struggled with many of the movements there as well, especially overhead squats, thrusters, and pistols. I have a tendency to fold forward with the front rack or overhead barbell movements, which I think is due to my inability to get my torso close to vertical and keep it there throughout the movement. So that ends up putting a ton of extra shear stress on my wrists and shoulders, which have also been aggravated. So I'll be thrilled if at the end of this surgery or a year from now, when I fully recover, that I can comfortably do an overhead squat even with just an empty barbell. So for conservative treatment, things I've tried, physical therapy, lots of band work, and glute bridges to really strengthen the glutes and abductors, which really didn't make much of a difference. I've tried a program called GMB, which is an online program involving lots of bear crawling and leapfrog type movements that promises to unlock your hips. I think it's probably a great program for a lot of people, but I actually found it made my issue significantly worse, probably because I was just ramming my bones together trying to get into a deeper squat. I've given up CrossFit for now, just gone back to a normal gym about 4 days a week, replaced my leg day with the knees over toes program, which is a pretty cool program. They have a lot of really interesting philosophies. That program, particularly the backwards walking, I think has helped my knee quite a bit. But again, not really any help for the hip. Maybe even aggravated it a little bit more with what they call the ATG split squat. I've also really tried to dial in my diet to try to get rid of any inflammation that may be underlying. Been eating pretty much strict paleo with the occasional beer or cookie maybe once a week. Focusing a lot on eliminating seed oils and getting my omega-3 to omega-6 ratio much higher. And tried about every joint supplement you can imagine, from collagen, biotin, turmeric, glucosamine, chondroitin, MSM. No noticeable difference with any of them. So I'll move the camera here and show you a few of the movements that really irritate me so I can kind of get a before and after as I promised earlier. Okay, I mentioned the anterior pelvic tilt, or Donald Duck butt. Imagine what that might look like. So I'll show you real quick what I'm talking about there. So this is my just natural stance. I feel like my pelvis is kind of tilted the bottom towards the back, and probably something more like that is where I should be. I'm not sure if this is causing any of my issues or at all related, but I want to at least document it and we'll see if it changes. Okay, next I'm going to just show a simple air squat. I really have to keep my toes pointed out almost to like approaching a 90-degree angle to be able to do it comfortably. And you'll notice my butt wink when I get close to parallel, so my tailbone really rounds out at the bottom. Probably right about there it starts. So that's not a super uncomfortable or painful movement. I do feel some pinching at the bottom, especially on the left side. But mostly it just feels really awkward and unathletic for me. And I've got a PVC pipe here, so I'll show a quick overhead squat with no load. And you'll see how badly my torso rounds at the bottom of that, or folds forward. You can imagine with any amount of weight overhead that starts to go badly pretty quickly. Right now I'll show you sitting cross-legged. So you can probably tell that my right leg is significantly lower than my left, although it's probably not where it should be either. But this really gives me a lot of pain on the outside of the hip and just a ton of tightness on both sides really. But right now, especially in the last few months, I've noticed really sharp pain when I cross my leg like this, especially if I push down on that knee at all. Yeah, the last thing I'll show is a test that one of the tests my surgeon did to kind of diagnose the issue, along with the MRI. He put me into hip flexion here, about 90 degrees with my hip and my knee, and then took my foot, and hard to tell on camera, but I'm moving my foot out towards the camera, so that rotation really causes sharp pain on the outside of my hip here, kind of the front outside, right in the hip crease. So that's where I'm at today, ready for a little bit of relief, hopefully. Honestly, my biggest life impacts right now are, number one, putting on my socks and shoes, which can be a real challenge some days. I feel like I have to really jerk my foot towards me just to get those on. And number two is my commute. I have about a 40-minute drive to work most days, and sitting in the car that long really can irritate my hip. Running, walking, and hiking are usually actually okay until I stop, and then I get a pretty a dull ache afterwards, depending on how far or how fast I went. My real concern is that I'm doing more and more damage every time I do the activities that I enjoy, and I found myself limiting how often I do them, and that's really not the life I want to live. Unfortunately, that probably means no snowboarding this winter. Today is June 28th, so not sure if I will be able to make it to the mountains this winter, but that's a sacrifice I guess I'll have to make. So I'll be honest, pretty nervous about the surgery and the recovery, but hopefully it'll be worth it, and I will check in a day or two with an update if I'm feeling up for it. Thanks for watching.